Hello, this is Dr. Adam Kopsky from Advanced Rehab and Medical here in Jackson, Tennessee, and I just wanted to share with you our new topic of the week that's been going since Monday. And so this week when you guys come in, please grab one of these handouts. Once again, they're at the front desk. They're also back at the rehab department, and if any of y'all are curious about it, just surely come to one of the doctors or therapy techs and ask to get one, because they really are informative. Now this week is really interesting and fascinating that maybe some of you don't know, but it's talking about low back pain and who will respond best to care. And so one thing that this talks about is a term called directional preference. And so if you ever noticed, if myself or Dr. Bone or one of the other doctors here, when you come in and get evaluated and come back to get an exam, we always check your range of motion, especially if you have that low back pain. And one thing we do this, what we're looking for is a term called directional preference. And what that means is see if I come here and I bend forward, and sometimes if you have pain and then it gets worse when you bend forward, then obviously that position is going to cause more pain. However, if we come backwards and that kind of gives you relief, then we know that you have a directional preference there in extension. And so some of the therapies we give you in some home care is we look at exercises geared to get your body in that position of extension to help the pain. So one thing, if you have like localized back pain, it's kind of common sense. You just look at what position is going to centralize the pain. And what I mean by centralize is if you have leg pain, we look for that position that starts reducing that leg pain up into the back, and that's a good sign. One thing is we see a lot of times is some people come in with back pain and leg pain, and they'll bend over, and now that starts exacerbating even more pain down the leg. So when we see that, that's a position where that's very poor, and we don't want to go into exercises geared to that. We want to get into extension to allow relief and bring that pain back up to the back and get it out of the leg. So one thing that we found really helpful is we have a lot of tools here in this office, and one thing we just implemented is our KDT table. Some of you may have seen. It's our new decompression table, and one thing it does is actually when you get on that table, besides distracting your spine, it also allows us to put you into that directional preference of relief. So whether it be going into extension or come down to a little flexion, and then also distract, so it aids in a quicker result. So of course, always feel free to come in and get evaluated and see if you're a good candidate, because we do have a lot of tools here. And of course, if you have any questions, don't hesitate to come find myself or one of the other doctors, and be sure to grab one of these handouts. So thank you very much, and I hope you have a great rest of the week.